Your arm is infected. It started as a small cut, nothing serious. At least, that's what you thought. But now the skin around it is black. It burns constantly. The pain keeps you awake at night. And today, your family has finally called the doctor. Relief washes over you. Surely he'll know what to do. Then he arrives. He opens a leather bag filled with knives, saws, hooks, and jars of leeches. Without washing his hands, without understanding germs, without anesthesia, he prepares to begin. Suddenly, dying from the infection doesn't seem like the worst option anymore. Welcome to medieval medicine, a world where the cure was often just as terrifying as the disease. Doctors understand bacteria, surgeons perform miracles, antibiotics save millions of lives every year. But for most of human history, none of that existed. In medieval Europe, medicine was trapped between science, superstition, religion, and pure guesswork. Some treatments helped, many did absolutely nothing, and some probably killed more people than the illnesses they were trying to cure. So tonight, let's enter the dark world of medieval medicine and discover why getting sick in the Middle Ages was one of the most terrifying experiences imaginable. The biggest problem with medieval medicine was simple. Nobody knew what actually caused disease. Today we understand bacteria, viruses, infections, parasites, but medieval people didn't. The microscopic world was completely invisible to them. Instead, many doctors relied on ideas inherited from ancient Greek medicine. The most famous was the theory of the four humors. According to this belief, your body contained blood, yellow bile, black bile, phlegm. If these humors became unbalanced, you became sick. Headache? Humor imbalance. Fever? Humor imbalance. Broken leg? Well, probably still a humor imbalance somehow. Doctors spent centuries treating illnesses based on a theory that was completely wrong, and millions of people paid the price. Now let's talk about one of the most famous medical treatments in history, bloodletting. The idea was simple. If disease came from too much blood, remove some blood. Problem solved. At least that was the logic. Doctors used knives, lancets, and other tools to open veins and drain blood from patients. Sometimes huge amounts. Imagine already being sick, already weak, already dehydrated. Then someone decides the solution is to remove even more of your body's resources. Bloodletting became one of the most common treatments in medieval Europe. People were bled for fever, headaches, infections, stomach problems, mental illness. Sometimes it helped accidentally. Most of the time, it probably made patients weaker. But because doctors believed in it so strongly, the practice continued for centuries. If knives weren't available, there was another option: leeches. Thousands and thousands of leeches. Doctors would place these blood-sucking worms onto the patient's body. The leeches would attach themselves and begin feeding, slowly drinking blood while swelling to several times their original size. The sight alone must have been horrifying. Imagine lying in bed, covered with wriggling black worms, while your doctor calmly watches. And yet medieval people considered this medicine. Strangely enough, leeches weren't entirely useless. Modern medicine still occasionally uses them in specialized procedures, but medieval doctors used them for almost everything, and often for the wrong reasons. Now imagine the worst pain you've ever felt, then multiply it by 10. That's medieval surgery, because anesthesia basically didn't exist. If you needed an operation, you stayed awake. Fully awake. Doctors might give you alcohol, herbal mixtures, or prayers, but that's about it. Then the cutting began. Broken limbs, infected wounds, tumors, amputations, all performed while the patient screamed in agony. Speed became more important than precision. Some surgeons became famous for how quickly they could remove a limb. Not because it reduced risk, because it reduced suffering. A little. Tooth problems were another nightmare. Today, a dentist can fix a cavity in minutes. Medieval dentistry was far less comforting. Most dental procedures involved one solution: pull the tooth. That's it. No advanced fillings, no root canals, no modern painkillers, just force. Many tooth extractions were performed by barber surgeons. Yes, the same people who cut hair sometimes pulled teeth. Imagine getting a haircut and an extraction from the same person. That was medieval healthcare. And honestly, if you've made it this far without cringing, you're stronger than most people. Because medieval medicine wasn't just primitive, it was terrifying. So if you're enjoying this dark journey into history, subscribe for more immersive stories about forgotten civilizations, disturbing traditions, and the brutal realities of human life throughout time. Now we arrive at one of history's most iconic images, the plague doctor, long black robes, wide-brimmed hat, and bird-like mask. The outfit looks almost supernatural, like something from a nightmare. These doctors appeared during outbreaks of plague. Many believed disease traveled through bad air, so the mask's beak was filled with herbs, flowers, and spices. The hope was that pleasant smells would filter dangerous air. Unfortunately, the plague wasn't caused by bad smells. It was caused by bacteria, something nobody understood at the time. Still, the plague doctor remains one of the most haunting symbols of medieval medicine. Then came the catastrophe, the Black Death, one of the deadliest pandemics in human history. Beginning in the 14th century, plague swept across Europe. Villages vanished, cities collapsed, families disappeared, people developed fever, swollen buboes, and internal bleeding. Many died within days. Doctors had no effective treatment. None. Imagine watching thousands die around you while having absolutely no idea how to stop it. Fear consumed society. Some blamed witches, demons, foreigners, divine punishment. But nobody understood the real cause. The result was one of the greatest disasters in human history. Medicine wasn't only science, it was also superstition. People often mixed medical treatment with prayers, charms, relics, and magic. Some believed certain gemstones could heal disease. Others carried protective objects. Some sought miraculous cures from holy sites. To modern eyes, it sounds irrational. But when doctors couldn't help, people turned to hope. And hope can be a powerful medicine, even when it doesn't cure the illness. Medieval hospitals existed, but they weren't like modern hospitals. Many were operated by religious institutions. Their focus was often shelter, prayer, and comfort. Rather than actual medical treatment, patients received care, but there was little doctors could do for many serious illnesses without antibiotics, without germ theory, without advanced surgery. Even the best hospital had severe limits. Now, to be fair, not everything was terrible. Some medieval physicians made useful observations. Certain herbal remedies genuinely helped. Some surgeons developed impressive practical skills. Medical knowledge slowly improved over time. The problem wasn't that medieval doctors were stupid. Far from it. They were trying to solve impossible problems with limited knowledge. They were fighting an invisible enemy they couldn't even see. And that's what makes medieval medicine so fascinating. The dark truth about medieval medicine isn't that doctors were cruel, it's that they were trapped. Trapped in a world without microscopes, without antibiotics, without modern science. People suffered from diseases we can cure today with a simple prescription. A tiny infection could become a death sentence. A bad tooth could kill you. A routine injury could end your life. For millions of people, getting sick wasn't just unfortunate, it was terrifying. Because once illness arrived, there was often very little anyone could do. If you enjoyed this journey into the frightening world of medieval medicine, subscribe for more dark, immersive stories about forgotten history, ancient civilizations, disturbing rituals, mythology, and the terrifying realities of everyday life throughout human history. And tell me in the comments, would you rather face a medieval doctor or take your chances with the disease? Because after seeing those leeches and bloodletting tools, I'm not sure which answer is worse. See you in the next story.